Thank you so much. I just wanted to give a big thank you to the Cleveland Clinic for having me out here. I've been lucky enough to spend the past 10 weeks upstairs in the physical therapy department, and it has been an amazing experience, and I'm very happy to see so many familiar faces out here today. So today we're going to be talking about multiple sclerosis and the exercise essentials to consider when you are creating your own exercise routine. So last week we heard a little bit about this wellness. Wellness encompasses many different elements. Physical is one of them, but it also includes your emotional and your spiritual well-being. Last week you heard a little bit about them all, but today we're going to focus on physical wellness. Physical wellness is just simply taking care of your body for its functioning at the most optimal level. This can mean many different things for many different people. It can be helping getting out of bed easier. It can be transitioning from the bed to a wheelchair. It can be going for daily walks. All of these activities can progress and possibly become easier with the help of exercise, which is an essential element of physical wellness. Exercise is a structured, planned, repetitive physical activity over a long period of time. And it has with it the goals of either maintaining your physical function and your physical fitness or your physical functional capacity. So that's activities like we discussed, getting in and out of bed, getting in and out of your chairs. Research has shown that individuals who have MS can absolutely exercise, and it is well tolerated with no unsafe measures, and it's helpful to manage your symptoms. It can help prevent complications and other illnesses from arising. It has a neuroprotective action, which we'll discuss in a little bit, and actually it can help lower the annual relapse rate by 27%. That's a big number. So up here you'll see the most common symptoms of MS, and physical therapy can help with most of these. And the two main ones, fatigue and muscle weakness, can be targeted by exercise and a program to help you learn how to manage those two symptoms. So going into a little bit about those symptoms a little bit more, you might think to yourself, I know that MS is a disease of your neurosystem, but with the demyelination that is not reversible, exercise can help with those muscles that are also affected. It can help keep those muscles toned and healthy. And exercise can even show big improvements with the fatigue and your function and just your quality of life in general. Exercise can also help prevent complications and other diseases. High levels of inactivity can lead to diabetes. It can lead to obesity, osteoporosis, and other cardiac risk factors or cardiac conditions. Did you know that people who have MS are more likely to be inactive than people who do not? So in this study, they found that 78% of people who have MS are considered inactive, while only 38% of the general population is inactive. So this inactivity can lead to a loss of independence, and it can compromise your health, and it can compromise your quality of life. So earlier we mentioned neuroprotective actions. That simply means it can help improve disability and maintain your functional status. It can help you keep going to the grocery store and walking around those aisles. It can help you get out of bed in the morning. Exercise also provides an anti-inflammatory effect. which might help slow down the process. This is where we're getting that 27% decrease in lower relapse rate per year. So it's potentially, it can alter the disease progression. So we're talking about all of these wonderful benefits of exercise. It can affect our health and our bodies in so many different ways. Again, it lowers that relapse rate, which is a huge difference in our day-to-day and future quality of life. It can help improve your walking ability, especially if you come upstairs or go to a physical therapy program where you're supervised and the physical therapist can help identify little things that might be able to help walk better, easier, or for longer. Exercise can help you improve your balance, and it can have cognitive positive effects too, can help you with your memory. Exercise can reduce your fatigue, and it can improve your mood as well. And although there isn't quite as much research with those individuals who have progressive MS, it has been shown that they can still benefit from physical therapy and their quality of life. So I'm telling you all these wonderful things about exercise, and it sounds wonderful. Sounds great. Sign me up. But what's keeping us from our exercise program? What's keeping you down? Usually it's one of two things. It can either be environmental, like you don't have access to a facility, or maybe you're hearing conflicting information from your neighbor or from your healthcare provider, or you're someone else who has the disease. Or it can be personal, like you can't quite manage your fatigue levels, or maybe you have a little bit of fear or anxiety when thinking about exercise. Is there anything that keeps you guys from exercising? What keeps you?
It's hard to get off the couch if you habitually watch TV sitting on the couch.
That's true. It does. It's hard to start up and make exercise a habit. I'll give you some pointers later on in our presentation about different ways to get that motivation. One of the things that keeps me is just the lack of time. And it's important to identify these barriers so then we can overcome the barriers. Overcoming these barriers for me was scheduling a specific time in the day that I exercise. So I always get my exercises in right after breakfast. And so I set aside time, so that's no longer a barrier for me. Most importantly, your exercise program, it's all about you. Your exercise program needs to fit your capabilities and your limitations. The best exercise for you may not be the best exercise for your neighbor. It may not be the best exercise for your friend who has MS as well. Your exercise program needs to be individualized and really fit those capabilities and limitations. And as always, you should always consult a physician before you start an exercise program. Yes?
So when you said that people with MS exercise a much huge percentage less than people that do not have MS, what generally is the barrier? Is it a psychological barrier, like, oh, I have MS, so I can't possibly exercise? Would you say is that one of the barriers for an MS patient? Or maybe they think they can't?
You know, that's a wonderful question, and it really depends on the person. And I think in general with the symptoms that we most commonly see for individuals who have MS, fatigue being one, and muscle weakness, it's hard to get that motivation. It's hard to get up from watching TV and making the time. And it can as well be a mental block too. All right, folks. So getting into exercise a little bit more. Great question, though. Thank you. There are 4 main types of exercise. There's aerobic, there's strength training, flexibility, and balance. So for adult individuals who have multiple sclerosis with a mild to moderate disability, it's recommended that they have 2 days of aerobic activity per week and 2 days of strength training per week. Now, when you do your strength training, you should always have a day of rest between them, but you can combine your day of aerobic activity and your day of strengthening in one. It is also recommended to complete flexibility exercises every single day. It's recommended to have 2 to 3 sets per day, and you hold the stretch for 15 to 30 seconds. Now this can help decrease spasms and spasticity, and it can be very helpful when you're trying to complete those daily activities that you do, maybe making up your bed, going to work, whatever it may be. You should also be completing balance exercises 3 to 7 days per week. You can do this in sitting or in standing, but you especially want to complete your balance exercises if you are at a risk for falls, because it can decrease that risk. And it'll help you improve your ability to complete more tasks around the house or at work, just your functional activity. So before you start your exercises, each session, you should begin with a warm-up. A warm-up is really important because it'll start your blood pumping, it'll get oxygen to your muscles, and it creates a little bit warmer, flexible atmosphere so you have a more efficient and safer workout. You should have a warm-up that lasts between 5 and 10 minutes. However, the more intense your exercise that you're planning on doing is, you should stretch more towards the 10 minutes. And then for your warm-up, you should do whatever activity you plan on doing, just a little bit lighter. So if you're planning on going for a walk, maybe go for a little stroll first. Or if you're planning on going for a bike ride, maybe just lightly cycle for 5 minutes first. So aerobic activity can be anything from swimming to playing sports to biking or walking. The thing with aerobic activity is the goal is 30 minutes per session. Now, we can't all just jump up and do 30 minutes all at once. We should work our way to it. The CDC has shown that you can exercise in 10-minute bouts for your aerobic activity, and you will still receive the heart benefits, so the heart protective, blood pumping benefits. So when you're doing your aerobic activity, you should always have a goal of getting to 60 to 80% of your maximum heart rate. It's pretty hard to judge if you're not monitoring it, so a good rule to keep in the back of your mind is during the activity, you should be able to talk. It shouldn't be so hard that you're not able to get some words out. But at the same time, you should not be able to sing, because then it's too easy. You can also look at this scale here from 1 to 10. Notice there's a circle in the medium range, 4, 5, 6, 7. You should always try to have a medium to moderate exertion. So you don't want to work too hard, and you don't want to work too light either. So other aerobic guidelines are to always monitor your breath. You don't want to be breathing too hard. If you feel like you can't get a good breath in, you should slow down your activity or stop until you catch your breath. Always ask yourself, how hard am I working? Am I working in that moderate range? If not, you should try to adjust the activity so that you are. And then in order to improve aerobically, once an activity becomes too easy, then you can either bump up the time or you can bump up how hard you're working. Going into everyone's favorite, strength training. So there's a lot of different ways you can strength train. You don't have to just lift up and put down weights. That's not what we want you to do. We want you to stay excited about exercise. You can do this with Pilates, seated exercises. You can do boxing, which I gotta say, that's pretty fun. So with the strength training, you want to have a goal of 2 sets of 10 to 15 repetitions. A repetition is when you pick up a weight and when you put it down, or when you jab and come back. So once you do 10 to 15 repetitions, that counts as 1 set, and your goal is 2. And as always, you can work up to that. So in order to increase your strength, you want to work between 70 and 80% of your 1 rep maximum. Again, that's kind of hard to just, I know what I'm doing. So a good way to do this at home is to pick a resistance that it is moderately hard, but you're able to safely finish all of your reps. So when you are strength training, you should always make sure to rest between your sets. You should use proper form and technique. If you use improper form or technique, you're more likely to have an injury. You should always start with light resistance until you're confident with the movement. And then you should always focus on moving with your breath. You should never try to hold your breath when you are exercising. It is not good for your heart. You should, in order to improve, you can increase the reps or the sets or the weight that you're lifting up. Finally, flexibility training. You can do this with yoga, Pilates, or with just static stretching. It's recommended to do 3 to 5 times per day. And you want to stretch with those muscles already warm. You don't want to go just straight into full stretch. You got to warm those muscles up a little bit. You can also stretch after you complete your strengthening or your aerobic exercises as a cool down, which we'll talk about a little bit more later. Other guidelines to follow when you are training to increase your flexibility is to, again, watch your form and your technique. If you do it improperly, you are at risk for an injury. You should move slowly in and out of the postures, and you should focus on your breathing with deep breaths in and breathing out long. You should hold the positions for 15 to 30 seconds, and in order to improve your flexibility, you should always try to progress once something becomes too easy. So once it's too easy, you can increase the time that you hold it or the depth of the posture or the stretch. Balance training. This can be done in many different ways, and we actually do it every day and we don't even realize it sometimes. You can do balance training with yoga, with standing exercises, or balance-specific exercises. And with balance training, progression is key. So for example, you would start with holding on with 2 hands. Go to 1 hand, maybe a finger, and then progress to no hands. With balance training, we always want to stay safe. That's our #1 priority. So when you're testing your balance and you're training your balance, you should always have a stable surface like a countertop or a chair that doesn't have wheels next to you. Always be patient because balance training takes some time to see an effect. So practice daily and keep working on it. Finally, cool down. We always want to cool down slowly, so we want to keep that blood moving through our body. It puts less stress on our heart to cool down slowly. So, and using stretching as your cool down can also help reduce the lactic acid buildup, which can later lead to cramps or stiffness. And always, always, always remember to breathe. So 2 hours after you exercise, you're not quite done yet. You should check in with yourself and think to yourself, how do I feel? Sorry. Do we have a power cord? So we'll keep going. No, it's the, yeah, it's HP. Thanks. So 2 hours after you're done exercising, if you don't feel as good as you did before you started the exercise, maybe you did a little bit too much. So if you're feeling not your best self 2 hours later, maybe scale back the next time you have your exercise regime. Maybe do a few less sets or lift just a little bit less weight. So don't let this confine you. However, this is a very good beginning routine to do exercises Monday and Wednesday for your aerobic activity. You can do a recumbent stepper for 30 minutes or so. And then Tuesday and Friday, you could do your strengthening exercises. So it doesn't take over your entire schedule, but you are getting those recommended amounts from supported from research. And then always, every day, you should complete your flexibility and your balance exercises. It's dead. It's okay. All right, folks. So I know that we've all heard, if you want to grab one of these, if you don't have one, we're about halfway done. So when you are exercising, there's a lot of different options. You don't need to confine yourself to one type of exercise. There is so much variety, and it can keep it interesting, but it's also good for your body to continually challenge it in different ways. And there are a lot of different resources available in our community that we have handouts for later if you are interested, for yoga for individuals who have MS, as well as seated community classes, and I believe there's a lot of different things. Okay, so I know we've all heard that saying, when it comes to exercise, no pain, no gain. Now, I don't know about you guys, but I don't believe in that at all, and neither should you. You should never exercise to where you feel pain. If you feel pain, you should scale back. Maybe talk to your doctor. Make sure what you're doing is appropriate for you. It's not what you do in a single session that matters. It's what you do every day. So when you're exercising, you should also take different methods to conserve your energy. As we know, that's one of the most common symptoms of multiple sclerosis, is fatigue. So we want to minimize our effort that we put through in our daily life. We want to plan ahead. We want to make sure that we have enough time for everything. We want to schedule our time for exercise and always incorporate different rest breaks. So with your rest breaks, imagine you have a thermometer. If you're using up all of your energy without taking a rest break to regain some, you're going to run out pretty quick. So use some energy, take a rest break. Use some energy, take a rest break. That way you can get to all of the activities that you need to do throughout the day. You can also use adaptive equipment or strategies to help you. And always decrease the exposure to heat, because that can also affect you. There's many different ways you can decrease this heat exposure. You can do your exercises in an air-conditioned room. You can also use different cooling products, like they have vests, they have cooling scarves, And then if ever you get too warm, you can get temporary relief by having a nice cool glass of water, which you should be having anyways if you're exercising. When you're exercising, you should always start smart. Don't put too much on your plate all at once. You should start slow, gradually work into it. Remember that technique, it matters. So if you're not comfortable with an exercise, you should always seek out professional help, like with an occupational or physical therapist, to help guide you to learn the proper technique. You should always stay consistent. Oh, thank you. I'm going to catch us up really quick. See, there's our thermometer. Don't let that get to red. Take some rest breaks. You should always be consistent in your exercises. It takes a long time, regular participation over time, to reap the maximum benefits of exercise. It doesn't occur in just a day or a week. It takes a while, 6 to 8 weeks, in fact, to learn to increase your amount of strength. It also takes a long time to form that habit, like we were talking about earlier. You should look at exercise as it being an automatic, daily part of your life. To create a habit, it takes anywhere between 12 and 254 days, with an average of 66. But in order to create that habit, it takes a lot of repetition. The more times you do something, the quicker it will become a habit. So the more often and more frequent you exercise, the quicker it'll become a part of your daily lifestyle. So we can create this habit by starting with a small goal, and then associate that goal with an already established routine. So maybe I want to do my strengthening exercises and stretching right after breakfast. Slowly integrate that in. Associate your stretches with right after breakfast. Once your goal is achieved, aim bigger. Add some aerobic activity in. And always, you should stay accountable. So stay accountable with yourself, with a friend. You can keep an exercise log and track your progress. You can join an exercise class, which I have been a part of the past few weeks, and it has been an amazing experience. There's both a seated exercise class as well as a standing exercise community class available in this room Tuesdays and Thursdays, and if you're interested, we can provide some more information to you afterward. Does anyone else have anything that they do to stay accountable?
Plant a garden.
Yeah? Yoga, yeah. With a class, with a friend. Tai Chi, that's wonderful. So, yeah, then you have to come back and tell us if you did it or not, too. All right. You should always start smart. Start slow, learn the proper technique, and monitor throughout your exercise program if you become too fatigued or if you don't feel anything and maybe you're not working quite hard enough. Stay consistent. Create that habit. So, the best way to start your own exercise program is to set up a schedule. Find activities that you enjoy, like Tai Chi or yoga, or coming into physical therapy to get that specialized, helpful guidance. Help identify your barriers, address them, set aside the time, or help find different ways to monitor your fatigue. Exercise in a group or do it with a friend, but most importantly, with all these exercise programs, It's very individualized, and so you have to believe that you can do it yourself. So you might be thinking, when is it appropriate to ask your doctor about physical therapy? If any of these questions sound familiar to you, it might be time to have that conversation. So if you're unsure how to start your exercise or how to progress it, if you notice that you're starting to trip or stumble, or if you're just worried about falling, does fatigue keep you from doing the things that you once were able to do? Or have you noticed a change in your ability of stuff that you can do around the house or at work? In physical therapy, we'll provide you with a lot of different education about the physical symptoms of multiple sclerosis and what you can do to alleviate these symptoms. We'll introduce you to aids and adaptive equipment in a safe environment and allow you to try different activities and different devices that might be assistance to you. We individualize the care for you. We can target the weakness, fatigue, balance, all based on your goals and what you want out of physical therapy. We can also help identify different community resources that are currently available and that many of you are partaking in that might help you go towards your goal as well. Different interventions will vary upon the person and the disease course. We'll target different impairments that we find, and we'll create a plan of care designed especially for you. So here are some exercises that you might become familiar with if you are or have ever been or want to come to physical therapy. We'll probably do some seated exercises with you with different equipment. If appropriate, we can do weight bearing and gait training for different individuals. We can help you discover if an assistive device is right for you. If you're unsteady with your walking or standing, you're falling, or maybe you just have a fear of falling, or if you have a reduced tolerance for walking longer distance, like in the grocery store, or maybe you are depending more upon your caregivers. So here are some different assistive devices, and we'll help find what is the most appropriate one for you, be it moving down to a walker to a cane, or from a cane to a walker. You can try these different devices with us in a safe environment, and we'll be able to teach you how to properly use it. Same with orthotics for ankle weakness. We have ankle AFOs, which can help increase your foot up, or the neuromuscular FES system, which we can also help guide you if it is appropriate. We can work on core exercises with you and help target what your goals are, be it sitting like this, or kneeling, or on a mat. We'll also target dynamic walking exercises, if appropriate, with whatever device is appropriate for you, and balance exercises in many different ways. Also available is occupational therapy. Now, occupational therapy can help with many, many different things. It can help you with ADL training, which is activities of daily life like dressing, eating, showering. If you're having difficulties with any of those, it might be time to ask your doctor about adding occupational therapy. They can help you with managing your fatigue levels and stretching an exercise program. They can help you with modifications that can be made to your home or your work or in your car for driving. In occupational therapy, they'll also help with memory and cognitive rehabilitation and managing your stress. They can help you establish a routine that will encompass all of the different aspects of wellness and help guide you to that. So exercise is a very important key to living the best life that you can. It is a lot to take in, but wellness is not just a journey that takes one day or a week or even a month. It's really a lifelong process, and your physician can help guide you to that and help assess if you should talk to maybe a physical therapist or occupational therapist that can also help guide you to full health wellness. So on behalf of the LouRuvo rehab team, thank you so much for coming today. If you have any questions, we'd be more than happy to answer them. Yes?
How do you approach the cognitive rehabilitation?
Cognitive rehabilitation can take a lot of different forms. We normally, to address it, we usually add it in as a dual task. So are you able to walk and think at the same time? Are you able to recall different information? So it would be a lot of different practice techniques. And if you have anything. So, does that answer your question?
No, but I'll work on it.
You forgot it? Okay. Are you asking for different techniques that you can do it at home, or what services we could provide?
Yes.
Yes, okay. Well, that's wonderful. One of the best things about occupational therapy is that next door, Shayna, she does an amazing job that does a lot of memory, recognizing where your deficits are, what you can improve on. And so occupational would be the best avenue for that. And then we would just add it on in our plan of care in physical therapy. So we would do a lot of dual tasking, naming items, that sort of thing. It's a lot of practice.
Thank you.
Thank you. And I can get you more information about that too. Okay.
In the beginning, you compared the MS population to the general population.
Mm-hmm.
I don't think we can compare to the general population.
No?
That was the only part that I disagree with.
I think that each person shouldn't be compared to anyone.
That's right.
But when we do compare the disease of MS, we do feel that fatigue. We do have that weakness. So it is likely that those people who are a little more fatigued and a little more weak, they're less likely to be doing physical activities. So it was just a research study.
But it is, you would say that it is as important, if not more important, for a person with MS to participate physically in activity. Is that what you're saying?
Absolutely. I think that especially in the MS population, with those neuroprotective benefits that we saw earlier when I spoke about the annual relapse rate being lower, that is an amazing, amazing opportunity for individuals to modify their disease process. A lot of the medications that people who have MS take, they don't modify the disease course. They help with the symptoms. So this is the exercise is the only thing that's been suggested, but it needs more research, that can modify the disease course. So that's why you all should find some community programs, and that we're more than happy to provide for you.
I know there's a free MS yoga program on Fridays where I live at Los Prados. Begins at 1 o'clock in the afternoon, and it is free.
Oh, that's good. We should get that information from you so we can distribute it more widely to everyone that we have here, if it's not already in our list over here. Anything else? Okay, well, I just want to say thank you for coming today and learning a little bit about the exercise essentials when it comes to multiple sclerosis. It was wonderful presenting in front of you today, and thank you so much.